Hi, everybody. Hope you had a great first week of school. And let's learn about some outer ear disorders. Okay, so what is the outer ear? I was assigned macrotia, microtia, anotia, atresia, and stenosis. So to start, macrotia. This is when the pinna is abnormally large. Its measurements are bigger than what we consider standard. It can be congenital or acquired, which I found was really interesting. I assumed it was just congenital. I mean, it's more often congenital, but there have been cases where it's very slight at birth and then the proportions get bigger throughout life. And I was reading on this one case of a patient with macrotia, and he had it occur he was born, both of his ears were standard size, and then one of them just got a lot bigger. His pinna got a lot bigger than the other one. So that was cool. So yes, it can be unilateral or it can be bilateral. It usually does not affect hearing abilities. And so patients who want to get a surgical procedure most often are getting it just to make it appear more standard, more normal. It's more for self-esteem issues. And next. Oh. No. Okay. Microtia. Microtia in opposite of macrotia is when the pinna is abnormally small. So abnormalities occur in the auricle. It's one of the most frequent congenital craniofacial deformities. And I just added a picture of the spectrum of microtia severity. And so you can see in that first picture specifically how the pinna is a lot smaller in proportion to the concha. And yeah, just throughout these pictures, the more severe, the smaller the auricle is going to be. And then some fun facts. This occurs more frequently in males than females, and 80% of patients who have unilateral microtia, 80% of the time, it occurs on the right side. I don't know why, but it was a cool fact that I found. So microtia, like macrotia, can cause some self-esteem issues with patients and their, I guess, confidence about their appearance, but it can also affect psychological status in children, and it can affect hearing. And I guess if it's not treated, it would maybe affect psychological status later in life, like we have learned. If you're not able to hear, you're not able to really learn a lot if you rely on hearing, that is. And so that can have psychological effects. A risk factor that can affect the microtia or the development of the outer ear would occur during the embryonic development during pregnancy. Microtia can be unilateral or bilateral, and treatment options. These were really cool. So patients can get a prosthetic ear. They can have, that's supposed to say surgical reconstruction. Or this one was really cool, silicone artificial ear. So basically a doctor creates an ear like an appearance of an auricle out of silicone. So that's pretty cool. All right, anotia. So we're basically just going down the line here. Macrotia is when the ear is abnormally large. Microtia is when it's abnormally small. Anotia is when the outer ear doesn't, it's not existent. So it's completely missing. The cause is most often unknown, but it can be caused by genetic syndromes. And this fact was cool. There was a study done of infants that were born with anotia that proved, or I guess supported the theory that taking the medicine Accutane during pregnancy can actually affect the development of the outer ear and result in anotia. Some treatment options. You can have a total ear reconstruction surgery. This one's really cool too. Doctors will often use a piece of the patient's rib cartilage to create the framework, and then they'll attach a skin graft. And if the patient doesn't want to have the construction of the outer ear, they can get a bone anchored hearing aid. And also, if the patient does decide to reconstruct the outer ear to create the ear canal, there can be surgery to open up the ear canal. Okay, then we have atresia. This is the absence or underdevelopment of the ear canal. This isn't the best picture because obviously we can't really see just looking at a patient if they have atresia, but this is an example of atresia and microtia together. So if a patient has unilateral atresia, it can cause difficulty with sound localization ability, speech recognition. Obviously, if you're having difficulty hearing in one ear, it can be, I mean, we know this, hard to be able to localize where the sound is coming from. This is a congenital condition. It can occur unilaterally or bilaterally, and then combined with other abnormalities, like in this patient's case, microtia, it would cause conductive hearing loss. But atresia, if a patient has atresia, they more than likely have normal inner ear function and auditory nerve function. So it is just affecting their outer ear function. To treat this, like in anotia, there can be a bone conductive hearing aid or surgery to widen the ear canal or to open it if it is completely closed. Stenosis. This one's extra cool because I have this, but it's narrowing of the ear canal, and it can be acquired. It's usually congenital. If it is congenital, it can occur with atresia due to malformations of the external or middle ear. Etiologies include chronic inflammation, radiation therapy, trauma to the ear, poor healing of ear canal post-surgery. So if the patient did have, if they had microtia, and they had surgery to form the auricle, it can have effect on the ear canal. And then repeated ear canal infections can cause scarring, which over time will narrow the ear canal. So that would be the case if the stenosis was acquired. It would be, so like you could be born with a normal width of an ear canal. Oh, yeah, so to clarify, stenosis, it's not like shortening of the canal, but like the width of the canal, smaller. But if there are chronic ear infections, just the inflammation over time, if there's scarring, it would cause the ear canal to narrow. This can be unilateral or bilateral. The ear canal has the ear has a self-cleaning mechanism. So if that is affected, for example, with the ear infections, if the ear's not cleaning properly, the ear infections are going to continue, and that's going to have a lasting effect, or can have a lasting effect on the ear canal. And then treatment for stenosis, ear hearing aids, a bone conductive hearing aid, a bone anchored hearing device, and then surgical correction to widen the ear canal. It's just my references. Oh. Yeah, this one was kind of short, but it was cool to learn about, and hopefully I explained them all fairly clearly. Yeah, I think that's all. Have a good week, guys.